Hi everyone, this is the final video of the heart chapter, and in this video we are going to look at different phases of the cardiac cycle while keeping in mind what we learned about in the last video with the different electrical events as well as the muscular events and how they correspond on the ECG chart. So a quick review of the ECG is that a peak represents an electrical event, which is either depolarization or repolarization. The segments or the plateaus represent a muscular event, which is either a systole or a diastole. And we looked at what the different peaks on the EKG were in chronological order. Now we're going to start the cardiac cycle. This is again explained from an illustration, and animation would show this in real time as is posted on your canvas. But chronologically, we're first going to start with both the atria and the ventricles in diastole, meaning that both atria and ventricles are relaxed. They are not in a stage of active contraction. Now, this vessel here is your superior vena cava. This vessel is your inferior vena cava. They are both bringing deoxygenated blood from all of your tissues and putting it right here in the right atria. Meanwhile, these four, I'm going to change the color of the pointer here, these four vessels, 1, 2, 3, and 4, these four vessels are bringing in oxygenated blood. So those are your pulmonary veins, and they're bringing in oxygenated blood from your lungs to the heart and putting it in your left atrium. Now, while both atria and ventricles are relaxed, your AV valves are open. So this is your tricuspid valve, this is the bicuspid or the mitral valve. Both these valves are open, meaning there is some passive flow from each atria to the ventricle respectively. So the ventricles are already starting to fill up as blood is passively flowing from each of the atria to the corresponding ventricle. At this time, it is important to note that both your semilunar valves, your pulmonary and your aortic semilunar valves, are closed. So this is atrial relaxation or atrial diastole. Now, briefly after this step, what follows is the depolarization of the sinoatrial node. The depolarization of the SA node will depolarize each of the atria, and as a result, there is atrial contraction or atrial systole. When that happens, the atria squeeze, so the volume of each atrium decreases, the pressure inside each atrium increases per Boyle's law, and blood is pushed from an area of high pressure, which is in the atria, to an area of low pressure, which is the ventricle. So atrial contraction or atrial systole is going to push or squeeze the blood out from each atria into the respective ventricle. Important to note again with the valves is that both your bicuspid and tricuspid, which are the AV valves, are open, and both the semilunars are closed. So the next step that follows is known as isovolumic contraction. Now, in an isovolumic contraction, it is important to note that all the four valves are in closed position. So your two semilunar valves, as well as the tricuspid and bicuspid valve, are in closed position. The atria have diastole, so they are in relaxed mode, and ventricles are filled up with blood. And the ventricles are just now beginning to systole or contract. So that is the characteristic of an isovolumic contraction, is that the ventricles are now filled up, the atria are relaxed, all valves are closed, and the ventricles are just now starting to squeeze or systole. Now, the step that follows, step number 4, is the blood ejecting from each ventricle through the respective semilunar valves. So in step number 4, you will notice that the atria are relaxed. The semilunar valves have flipped open. So this is your pulmonary semilunar valve. This is the aortic semilunar valve. So ventricular systole is happening here. The ventricles are contracting, they are squeezing. The volume of each ventricle decreases and the pressure inside each ventricle increases. So that causes these semilunar valves to open, and from the right ventricle, blood goes through the pulmonary semilunar valve into the pulmonary trunk and off into each of the pulmonary arteries, from where it goes to the lung for the carbon dioxide to become gas and exit into the atmosphere. Now, if I change the color here, this is your left ventricle. Now, this is going to have the most powerful squeeze because from here, blood has to go the farthest. And therefore, this ventricle has the thickest layer of muscle in the myocardial layer right here. So during ventricular systole, blood from the left ventricle is going through the aortic semilunar valve, going through your ascending aorta, going through the aortic arch, and your major blood vessels are going to be branching out of various sections of the aorta. So step number 4 is ventricular ejection. So to recap here, AV valves remain closed, semilunars open, and ventricles squeeze to allow blood to go through each of the respective semilunar valves and into either the pulmonary trunk or the ascending aorta. Now, next step, step number 3 was isovolumic contraction. The next step is isovolumic relaxation. So here, the ventricles are in diastole. The ventricles are relaxed. They are purged out, so they're not completely empty, however. They still do have some reserve blood left over, which is what you're seeing here, the ESV. So ventricles are in relaxed position, and all 4 valves remain closed. The semilunars are closed and the AV valves are closed. So now we're going to look at a few variables of what is known as cardiac output. So cardiac output is basically the amount of blood that each ventricle individually pumps out per minute. So this is a measure of a single ventricle. And this is measured in liters per minute. There are 1,000 milliliters in a liter. Now, the equation for cardiac output is basically your heart rate, which is the number of times your heart beats per minute, times the stroke volume. Now, the cardiac output is basically looking at how blood, oxygenated blood, is being pumped to your tissues. So is it being pumped effectively, or are there deficits in it? So stroke volume is basically defined as the amount of blood that is ejected by the left ventricle. So SV involves the amount of blood ejected by the left ventricle per heartbeat. So you check your heart rate using either a machine, which is either clipped onto your finger, you can have a blood pressure cuff, or you can do it manually. And that is multiplied with stroke volumes, which is the volume of blood pumped out by your left ventricle per heartbeat. Now, when you multiply these two variables, you get your cardiac output. So cardiac output essentially measures the effectiveness of your cardiovascular system, which is to deliver oxygen and through oxygenated blood to all of your tissues in the body. Now, exercise is a way to increase your cardiac output. Now, an example is if someone's heart rate is 75 beats per minute and their left ventricle is ejecting about 70 milliliters per heartbeat, 75 beats per minute times 70 milliliters per beat equals 5.25 liters a minute. So when you multiply these, you might get a value that's in milliliters, but we want to report it as liters per minute, which is what 5.25 liters per minute is. Now, cardiac output varies based on what your tissue needs are. So if you're an athlete and your tissues are getting a lot of workout and undergoing cellular respiration at a faster rate, and carbon dioxide is accumulating in your tissues at a faster rate, then your cardiac output has to increase to meet those demands from your tissues. The smaller the heart, the smaller the stroke volume. The larger the heart, the larger the stroke volume. So therefore, women and children tend to have smaller stroke volumes than adults and males. And endurance athletes will have thicker heart walls and have increased stroke volumes, and therefore will have increased cardiac. Cardiac reserve is an individual's ability to increase cardiac output above the rest level, and this directly correlates with the amount of physical activity that an individual is pursuing through the day. So essentially, in someone that isn't an actively training athlete, the cardiac output can increase fourfold, and in someone who is actively training, it can increase about sevenfold. The last couple of concepts is when a person's heart is beating too slow versus when a person's heart is beating too fast. So a persistently low resting heart rate is called bradycardia, and it is a normal change in athletes. So athletes tend to be bradycardic. Their resting heart rate is lower than a sedentary person, for example. There are a lot of factors that do affect bradycardia. The opposite of bradycardia is tachycardia. Tachycardia is a persistently high heart rate characterized by over 100 beats per minute, and most people undergo short instances of tachycardia every now and then when they have anxiety, illness, or something even more serious like heart disease. So I think in these lecture videos, we've covered mostly all of everything that we're going to be doing in this unit. There are some more things that we're going to be going over in lab interactively. So I'm going to end this video right here. Thank you.